Hi, I'm Dr. Amy Krambeck. I am a professor of urology at Northwestern Medicine in Chicago, and I'm also the division chief for the Division of Endourology and Stone Disease, as well as the fellowship director for the Endourology Fellowship. Today, I am going to be presenting a case of an extremely large prostate that was managed urgently with holmium laser enucleation of the prostate. He had presented to multiple different hospitals throughout Chicago with difficulties with blood in his urine, hematuria, difficulties urinating, clot retention, and eventually came to the Northwestern ER, where he underwent a CT scan because of blood in the urine and inability to urinate. As you can see on his CT scan, he has an extremely large prostate, as well as a very large bladder stone. When we measured out his prostate, we found a volume of approximately 660 cc's, as well as a 4 centimeter bladder stone. The patient was having difficulty urinating, so we placed a Foley catheter and admitted him to the hospital. He had previously undergone a transurethral resection of the prostate elsewhere approximately 4 years ago, but never really could urinate well. He tried intermittent catheterization for a period of time, but was unsuccessful. And it's pretty obvious, given the size of his prostate, that that would be difficult, and had really just struggled on finasteride and Flomax. So this gentleman needed intervention, and his symptoms were not going to get better with just medication. So after his admission to the hospital, I found some time and we brought him to the operating room for a holmium laser enucleation of the prostate with cystolithopaxy. So when I placed the scope into the urethra, I was unable to advance the scope all the way into the bladder. Therefore, I started with the apical dissection and was then able to get into the bladder through the anterior plane. The enucleation was actually rather quick. I used 2 joules and 60 hertz and was able to do the full enucleation in 42 minutes. There was some bleeding, but not severe. Visualization was very good. However, morcellation was really the more difficult portion of the case. The tissue was extremely dense and rubbery, so it took approximately 2 hours to morcellate this tissue. I used 2 different morcellator blades, and the fellow as well as the resident and I took turns to eliminate fatigue. But eventually, after 2 hours, all the tissue morcellated easily. And the final result was 601 grams of tissue removed. Just to give you a little bit of perspective, most of you know that the prostate should be around 30 grams. The human heart is around 500 grams. And this gentleman's prostate was 600 grams that we removed. So extremely large prostate. We then turned our attention to the bladder stone. It looked somewhat hollow on the CT scan, and as we started lasering the stone, we used the same laser settings of 2 joules and 60 hertz with the holmium laser. We got to this kind of strange core, and it turned out as we removed the layers of the calcifications that the core was actually plastic off of the gentleman's catheter wrappers from when he had tried self-catheterization many years back. So I was able to pull out the plastic piece with grasping forceps after all of the calcifications were removed. So catheter was placed at the end of the case. He spent the night in the hospital. We removed the catheter the next morning, and he was able to void and go home successfully. So he spent very little time in the hospital, no massive blood loss, no blood transfusion, and went home without a catheter the next day. His pathology was benign, no evidence of cancer, and he will continue to get yearly PSAs and checkups for prostate cancer screening. But if you believe the data on HoLEP, the 20-year data shows a 1.4% retreatment rate. So this gentleman has a good chance of not requiring another procedure in the coming years, and hopefully we fixed his massive prostate for good. Thank you for allowing me to present this case.